Zero Hour. I'm your host, Richard RJ Eskow. As we've already said, this week marks the introduction of new legislation that would establish Medicare for all in this country. It's a cause I've personally been involved in for a long time. Before, during, and after my tenure with Bernie Sanders, I have a piece up about Medicare for all myself, as do a number of other people. It's vitally important legislation. And here to join me now to discuss that legislation and perhaps some related topics as well is the president of an organization that has been invaluable. I can tell you from my own experience, has been invaluable for many years in leading this fight. Deborah Berger is a registered nurse, and she is president of National Nurses United, NNU. And so first of all, Deborah Berger, welcome to the program.
Thank you for having us on. This is really an exciting day for everyone. And I couldn't be more proud to be here today.
Well, we're delighted to have you. And as we record this on Thursday, what I believe are the first Senate hearings ever on Medicare for All are underway. And a leader in your organization, Bonnie Castillo, I believe, is testifying before the Senate at more or less as we speak, or perhaps she's already finished. But is that correct?
That is correct. It's the very first Senate hearing for the Medicare for All system. It's sponsored by Senator Bernie Sanders and is right now having its hearing. So we're really excited because nurses have been working for this day for decades. And hopefully at some point we'll be able to have universal health care.
Well, I certainly hope so. That's my fervent wish. And I guess I would start with this. First of all, am I correct in understanding that as we record, it is also National Nurses Day or something?
It's International Nurses Day. So Senator Sanders picked this day to introduce the legislation, and our executive director, Bonnie Castillo, is providing testimony for why nurses support Medicare for All.
So first of all, I just want to say a word in defense of nurses, or not in defense, I don't need no defending, but in support of nurses. Nurses are such a valuable part of our society. They have been heroes, one and all, during this pandemic under unbelievably difficult circumstances. They also are unsung heroes, in my view, for the number of times so many nurses I know have saved patients from a physician's potentially lethal mistake. But perhaps we shouldn't talk about that, because we're not supposed to also acknowledge that nurses bring a wisdom to the medical care system sometimes that is not reflected in the social hierarchy. I don't know. Am I off base saying
No,
that?
you're right on. The care work in this country, in fact, globally, really isn't valued. And it just happens to coincide with the fact that most care work is done by women and people of color. And even though we were deemed essential during the pandemic, we weren't treated as if we were essential. If you have a rare commodity, you value it and you take care of it and you nurture it. And that's not what happened during the pandemic. And it also highlighted the fact that we do need Medicare for all, because many people were struggling to pay their rent, their mortgage, their grocery bills, all of that, and still try to access health care, even though the Affordable Care Act did provide for coverage during this time. It still left significant gaps in funding for comprehensive coverage.
It certainly did. And, by the way, before we get off our tribute to nurses, my first job was as a nurse's aide, and people were always asking me, are you doing this because you want to be a doctor? And I always, because of that elitism kind of, I think. And I said, no, I just wanted to know what it was like to care for people in that intimate a way. And I did not get good performance reviews, I have to tell you, in full confession. My performance reviews said that Richard is empathetic and the patients love him, but he's not very good at the actual tasks involved. But
there you go. They didn't involve the caring work. And sometimes what you need is somebody to sit and hold your hands for a few minutes and not do the task that you were assigned at that moment. And that's what nurses do.
Exactly.
They have this ability to evaluate and assess a patient's needs. And if a patient needs somebody to talk to them or talk to their family first and then do that assigned task, then that should be the way it should be. But care is not valued in this country.
That's absolutely true, which means, of course, the patients aren't valued. What my bosses didn't know, for example, in that job, one of our patients that everybody considered a nuisance, 95-year-old man, fought in the Winter Palace revolt in 1905 in St. Petersburg. These patients were repositories of amazing vitality and history, and that which nurses also connect with in some way, that's not valued either. And that seems to me to be a terrible shame.
We're expendable.
Well, I hope not expendable, but certainly not valued as much as you should be. And I hope part of the fight for Medicare for all is the fight to recognize that all forms of care are important because to me, and let's talk about Medicare for all for a minute.
Exactly.
I will confess to you, spent a number of years working in the health insurance industry. I was very good with numbers. I was very good with designing computer systems, data analysis. So I know financially how that industry works. And it is absolutely transactional. And the only way health insurance companies make money is by denying care. That is the sole engine of profit. And so you're actually, when you have something like the Affordable Care Act, certainly made some lives better, but you're actually entrusting the delivery of care to people who are motivated to deny care. And to me, that is the kind of macro reflection of what we've been talking about in the nurse to patient relationship. It is transactional rather than human. And it seems to me it's about time we had a medical system that was human and not transactional. Do you get what I'm driving at?
I do understand exactly what you're pointing out. And that's why nurses understand that we do need a healthcare system that is a real healthcare system, not access to health insurance, because we know that insurance companies make money, and the only way they make money is by denying care. So every dollar in profit they make is a dollar that did not go to patient care. And although the Affordable Care Act did make improvements to our healthcare system, it still left the insurance industry in charge of how you access healthcare or whether you even get healthcare. And it's still today, 28 million Americans are still uninsured, and millions more are underinsured because of the high deductibles and premiums that prevent people from going to see the doctor.
That's so important. And I'm so glad you mentioned that, Deborah Berger, because I was at a meeting in Maryland where they were talking about how many people are underinsured, under 65 people are underinsured in the state of Maryland. And I would argue that everybody on employer health insurance or private health insurance is underinsured to a greater or lesser extent. We had that case of the teacher in Texas who came down with the flu and they told her antibiotics would cost $120. Well, that's a lot of money to most households, so she didn't spend it, and then there were complications and she died. Repeat that story often enough and you have one study says 68,000 unnecessary deaths per year out of this system, and I would assume that nurses were in the vanguard of this fight, because you see those deaths, you see those, right?
We absolutely see patients unable to afford their prescriptions. And when you actually look at the statistics, 1 out of 5 adults, 1 out of 5 Americans are unable to afford their prescription drugs that the doctors prescribed. They establish GoFundMe accounts so they can get their cancer treatments. They do GoFundMe accounts to afford necessary surgeries. And it's criminal. It really is criminal when you think about the fact that as these people are struggling with GoFundMe accounts, and I read there's about 1/3 of the GoFundMe accounts are to pay for healthcare costs. And so it really is a national shame. It really should be our shame, because other countries that have fewer resources and less money are able to provide healthcare for every one of their citizens in their countries, and we do not.
How often do you think, and again, we're talking with Deborah Berger, president of National Nurses United and a nurse, what are some of the ways that this might touch, this broken system might touch a nurse's daily life? I mean, I assume, obviously different nurses.
Well, if you talk to any nurse, just go up on the street and you say, "Oh, hi, I'm, doing a survey." Any nurse will be able to tell you that on a daily basis, when she's admitting a patient for a surgery or for a treatment in the hospital or for outpatient cancer treatments, they will admit that they are only able to afford their chemotherapy drugs, and they're having to either stop taking their pain medications or cutting them in half or borrowing somebody else's pain medications because they can't afford the chemotherapy, the pain medicine, and their regular chronic conditions drugs. We've had several experiences where patients' blood pressure is so high that it's threatening a stroke on these patients because they were cutting their blood pressure medicines in half so that they could afford to take them. So they end up in the hospital even sicker than when they were originally prescribed the drugs. And what's really absurd is that the federal government will cover patients on dialysis once they qualify for dialysis, so they get health care, so they become Medicare, Medi-Cal eligible, but they won't cover the blood pressure medicine, which is cheap, $5 a prescription, to prevent them from getting and needing dialysis and losing their kidneys. So it's not even cost effective when you think about it, the way this system is run. And it could save not only lives, which are extremely important, but it will also save money.
Right, absolutely. It's so important. And, you guys at National Nurses United, as we've already mentioned, have been in this fight for a long time. I've been involved in it, going on 20 years now. But when you guys first got involved, and when people started talking about this, there was a general attitude among political types, pundits, what have you. It's a nice idea, right? But it's not feasible. It's utopian. It's blue sky. Even though every other developed country in the world has it, still, for some reason, it was an impossible dream. And how did you guys, I'm just curious, and obviously there's a diversity of personalities and players involved, but in those early days, if you were involved back then, How hard was it to keep the faith that this was something that could actually become part of the national dialogue and hopefully someday come to pass?
Well, what keeps us going is the fact that 52 years ago, the United States did this enormous giant step for its senior citizens who were living in poverty and struggling to meet the costs of daily living and be able to afford any kind of health care. They were living in poverty. So what they did was they said they instituted a Medicare program into law by passing universal health care for people over 65. It's so popular, people don't even understand that it's a government benefit. They talk about keeping the government out of my health care, not knowing that it is administered by the federal government, and they're extremely efficient at it. And the other thing that we have to understand is that other nations spend far less on healthcare than the United States, and they have better outcomes. Their life expectancy is higher, and their infant mortality rates are lower. And we could use Canada for an example. They spend $4,644 a year per person. The US spends $10,000 per person for healthcare. And that's an average because some people don't even have $10,000 to spend. And Britain, $4,192, and they have a national healthcare system. And what we're saying is we're expending all of this money with worse outcomes and less control over our choices. So we know that we can do this, and it isn't pie in the sky because all they have to do really in legislation is just get rid of the age, 65. What's so magic about 65? And we have seen in the hospital patients that needed to go to surgery for cardiac surgery, and they say, no, I can't do it today. I'm turning 65 on Tuesday. You got to do it then. And they said, no, you won't be here on Tuesday. And so why is it that the age 65 is the magic number, right? It seems ludicrous. And once it passes, people will go, why didn't we do this before? And the reason we're not doing it before, haven't done it before, is there's an incredible, powerful insurance and healthcare lobby that makes money off of illness and chronic conditions. So we need to change that dynamic to make sure that people in this country have healthcare, every single man, woman, and child.
And you must be, spending a lot of your time in your role at National Nurses United talking with people about Medicare for all. And so you've probably, certainly, I would think, encountered some of the same arguments the rest of us have. Starting with, what do you say when someone says, yeah, but it's too expensive?
Well, when I start talking about how expensive, when I hear people talk about how expensive it is, I remind them that people are dying every single day because of lack of health care. Not insurance. Some of these people have insurance. And that is extremely expensive. We also have patients that their only access to health care is through the emergency room. And we know that these patients could be treated in outpatient clinics, but they are not because they can't afford to go to an outpatient clinic. They're covered if they go to the emergency room, but they're not covered if they go to an outpatient clinic. So we have these perverse incentives to get the most expensive care instead of going to the least expensive care treatment center and still get the same outcome. So it gets expensive because another thing is people that are cutting their pills in half and not fully treating their chronic conditions. They're cutting their insulin prescriptions because they can't afford a bottle of insulin that costs $2 or less to make, but is sold for $700 through the pharmaceutical industry. So all of these costs add up. So in reality, we can't afford not to have Medicare for all.
And I think that's a great answer. And I also tell people, by the way, that, if they say they don't want the tax increase, well, the average family is paying $10,000 a year for inadequate health care. How about if you pay $5,000 and everything's covered and you have another $5,000 in your pocket? How does that sound? And but the other argument you get, in my experience, maybe you have others you faced as well, but the other common argument is, I don't want bureaucrats, right, between me and my medical care. What do you say when people give you that?
That's always a great argument for not having universal access to health care, because if there was ever a bureaucratic system, it is the current system we have, which is leaving the insurance companies in charge of whether you have access to health care or not. And they admit that they regularly deny whatever treatment your doctor is recommending and hope that you just go away. And it takes several appeals to finally get them to do what they should have done in the first place. So having a bureaucrat in charge is a very poor excuse, because in Medicare, when you're covered by Medicare, you go to your doctor and you see your doctor. There is no gatekeeper that says you can't go to see your doctor. The Medicare gets billed by the doctor and they reimburse them. So there is no gatekeeper there. And all of the systems that we've looked at in Canada, in Taiwan, and Great Britain, all of those systems do not have gatekeepers. What they have are people that pay the doctors for your visits. Right now in the U.S., the biggest gatekeepers are the insurance companies. And they deny care so they can make money. That's their job. That's what their shareholders actually expect.
Can I make another confession to you? As in my corporate career, I had 400 utilization review nurses reporting to me at one point, and their job was, I'll be candid, it was to deny care. And we always said, and I think even partly believed, it was inappropriate care, but I see in retrospect that wasn't the case. Each claims office had a nurse manager who reported to me. One year I won the diversity award because no executive had more women reporting to him than I did. And I tried to tell him, I don't really deserve this. My position is a patriarchal position. It's not, I'm not a hero of diversity here, but that is the system that we're dealing with, right? And my feeling is that people will listen to a nurse on this subject. So at least a lot of people will, more than they will listen to somebody like me who's never, except for that one brief experience, provided care. And to me, it's really important that people understand the sort of human touch element of this too. You and I have been talking about the big picture, but one of the things you and your fellow nurses can offer, in addition to the big picture that you guys are so good at communicating, is just the inhumanity of it. And I think that comes across. You get what I'm trying to say, right?
I do understand it. And that's why it's key that nurses are fighting for Medicare for all. And because of our credibility, you are right. People believe more what nurses have to say about healthcare. And it only makes common sense when nurses provide care in the hospitals. They treat patients in a holistic manner. They don't look at just your disease that you're in the hospital for, but they evaluate all of your chronic conditions. They also look at your family life, your social life, to make sure that everything is in balance and that you're getting the treatment that you need with the support from your family, because those are the people that are key to making sure that you get out of the hospital safely and thrive.
And as a patient, I can't tell you, having been a patient, I can't tell you how much that matters. That for anybody listening who hasn't been in a hospital, to have somebody care, are you going to be able to cook for yourself? Are you going to be able to, is someone going to be there in case you have a problem in the night? Just somebody asking those questions, not only for the value of the services that they may then provide, but just the interest in your well-being, to me is...
Yeah. And when you think about it, how bizarre is it that you have to pass a law that says that hospitals can't just dump a patient on the street after they've been treated in an emergency room without making sure that they have some place to go? Why is it that they have to pass a law that says you actually have to treat somebody in the emergency room if it's an emergency? All of these laws, you can't possibly keep up with all of the things that the hospital industry is doing to make money. And that's the other reason nurses support Medicare for all, is that you could legislate until the end of days, and you still wouldn't be able to cover all of the bad practices that the hospital industry employs to deny care so that they can make money. Medicare, you have a need to see a doctor or go into a hospital, you're in there. They don't employ people to deny your care or anything like that. So it is key that people understand that when we're talking about the Medicare for All Act of 2022, it establishes a federally administered Medicare for All national insurance program. And it will be implemented over a 4-year period of time so that we can make sure that we get everything right and cover things that should have been covered under Medicare in the first place.
Right.
Like the real drug coverage and dental and hearing and vision services. And you think, well, why is hearing so important? Well, what they have found is that there is a higher incidence of depression and isolation with people that cannot hear. And then because they become depressed, then they don't take care of themselves and they can end up in the hospital. And dental health, you have a tooth infection and don't get it taken care of, you can get a meningitis, and that's an inflammation of the brain, in the lining in the brain and the nervous system, and you can become septic and end up needing hospitalization, and then Medicare will cover you. So we're talking about the ways in which a nurse looks at the entire system and says, this is not working for anyone. Let's have a rational system that covers everyone.
Well, I think that's beautifully said. And in closing, I just want to add that I was mistakenly, they thought I was having a heart attack. My heart's great. It was a mistake. Sent to an emergency room at the height of the pandemic in the middle of the night in the inner city hospital. And first, they kept me there. They wanted to make sure I was okay. For 6 hours, I watched nurses work under the most stressful and horrifying, almost like combat level conditions, with shooting victims coming in, other kinds of, and it was so overcrowded that I was just claustrophobic. At one point I said,
terrified.
Yeah. And at one point I just said, I'm going to leave. And they said, well, you could die. And I said, I don't care. I just have to get out of here. So I didn't leave. My wife talked me out of it. But the
smart woman.
Yeah. Well, yes, she is actually. But it's just my way of saying that my admiration for our nurses knows no bounds, whether it is in fighting for Medicare for all or in the daily heroism that our nurses show. So I want to thank you for coming on the program. I want to thank you for your work on Medicare for all, and I want to thank you and all your fellow nurses for the great work you do every day.
Thank you so much. We have a saying that we have on the back of our scrubs, and it's save one life, you're a hero. Save 100 lives, you're a nurse. And that's really stuck with me over the years, because nurses sort of take that for granted every single day. But every single day they intervene and make a difference in people's lives and save them. So I really appreciate what nursing has done for our culture, for our communities, and appreciate the work that nurses do.
Well, thank you so much again for coming, and thank you to National Nurses United for the great work on this issue. So,
okay.
And we'll be right back after this. I'm Richard RJ Eskow, and this is the Zero Hour.